Mycobacterial bandits terrorize a small Mexican farming village. The terrified and defenseless villagers journey to the US in search of gunmen to defend them. They end up with four: rifampin, isoniazid, pyrazinamide, and ethambutol, a band of gunslingers known together as RIPE therapy, the traditional four first-line drugs for treatment of tuberculosis. The Magnificent Four. The mycobacteria are ruthless. They grow slowly. They have an almost impermeable lipid-rich cell wall. They hide away in macrophages, and they develop resistance. A combination of two or more drugs is required to overcome these obstacles. The four drugs used in RIPE therapy for tuberculosis, rifampin, isoniazid, pyrazinamide, and ethambutol, will be represented together by this sign for these RIPE tubers. Oh, and by the hair of Yul Brynner, there's a sale today of 4 for 2, now 2 for 4. This is meant to emphasize the two phases of treatment. The initial phase usually consists of all four RIPE therapy drugs, lasting for 2 months, 4 for 2. This is followed by a continuation phase that consists of two drugs, usually isoniazid and rifampin, administered for 4 months, that's 2 for 4. But enough about farm fresh tubers and outrageously slashed prices, because the mycobacterial bandits have arrived, and the stage is set for a final showdown. But our heroes are ready. They were 4, but they fought like 400. Let's meet our cast. Isoniazid, the isolated ranger. Most agents, when used alone, lead to rapid development of resistance by mycobacteria. This lone ranger, however, can be used as a single agent for treatment of latent tuberculosis in order to prevent reactivation. Behind him, we'll sketch in our sketchy symbol for primary TB, our lung cactus with middle lobe cavities, and our symbol for latent infection, someone sleeping. So think of our isolated ranger as protecting this poor sleeping farmer from gunfire, preventing the development of upper lobe cavitary lesions, characteristic of reactivated TB. Remember, isoniazid can be used isolated, but only for latent TB. In active TB, isoniazid is combined with the other agents in order to prevent resistance and to make sure that all the mycobacteria are killed. Isoniazid works by inhibiting the synthesis of mycolic acids, which are essential components of the mycobacterial cell wall. In previous sketches, these mycolic acids were incorporated into the ponchos worn by mycobacteria, kind of like their covering or cell wall. And in this scene, we have some mycolic acid cacti extending above the wall of the town. They're fuchsia because mycolic acids are what give mycobacteria that acid-fast color. So remember, isoniazid works at the mycobacterial cell wall, inhibiting mycolic acid production. Just like our isolated ranger shoots down these fuchsia mycolic acid bandits atop the town wall. Isoniazid is delivered as a prodrug and then activated by CatG, a catalase peroxidase produced by mycobacteria. Our sketchy symbol for catalase is a cat, and here CatG is represented by the CatG bobcat, further activating even, our isolated ranger. Notice his tail is making a G shape. CatG is also involved in the development of resistance to isoniazid. This is accomplished by mutations that downregulate the expression of CatG, since CatG normally activates isoniazid. And as we can see, this mycobacterial bandit has noticed that the bobcat is only further activating isoniazid, so he silences it, downregulating it. It's a hell of a thing killing a mycobacterium. You take away everything he's got, and everything he's gonna have. It's pretty heavy stuff, so it's likely you'll experience some pretty serious adverse effects. Most students remember the adverse effects of isoniazid by associating the abbreviation INH with injury to nerves and hepatocytes. INH can cause dose-related neurologic side effects, including peripheral neuropathy, ataxia, and paresthesia. Our recurring sketchy symbol for peripheral neuropathy is stockings and gloves, reflecting the pattern of sensory loss. And here we have one of our bandits, unprepared in his stocking and glove long johns. Notice the design of the gun in the liver-shaped holster. It's designed after an acetyl group, and that's because one major method of INH metabolism involves acetylation by liver N-acetyltransferase. Patients who are slow acetylators, therefore, have higher plasma drug concentrations and longer drug half-life. While this is usually of no therapeutic consequence, this decreased clearance of INH can increase the risk of peripheral neuropathy. This is enacted in our scene by our stocking and glove bandit, reaching for his acetylation gun, but has already been hit. A slow acetylator, too slow on the draw. The neuropathy is caused by a vitamin B6 or pyridoxine deficiency, as isoniazid promotes the excretion of pyridoxine. However, the administration of vitamin B6 not only readily reverses neurotoxicity, it can prevent it. In this scene, pyridoxine is symbolized by a pyridoxine pair of dice. In our isolated ranger's non-shooting hand, he's taken off his glove and holds the pair of dice. I know what you're thinking. Did he roll a 6 or only 5? Well, to tell you the truth, in all this excitement, I kind of lost track myself. If we take a closer look, it seems he's rolled the lucky number 6 for B6. We've emphasized an ungloved hand to represent the prevention of stocking glove peripheral neuropathy when isoniazid is co-administered with vitamin B6. Acute isoniazid overdose can cause symptoms of central nervous system toxicity as well, such as altered mental status or seizures. So we've added some of our sketchy action lines to this falling bandit to symbolize seizure. Isoniazid-induced hepatitis is the most common major toxic effect. So here's our recurring sketchy symbol, the cow liver spot. This cow, seemingly unalarmed by the shootout, stands in the center of our sketch because, as we will soon see, all the ripe therapy drugs are associated with hepatotoxicity. With isoniazid, hepatocyte dysfunction is so common, you should expect to see an asymptomatic rise in aminotransferases in a significant number of patients. We'll symbolize this by making our innocent-looking stocking glove bandit raising the white LFT flag of surrender. The isolated ranger didn't fall for this trick. But watch out for clinical symptoms. Serious hepatotoxicity can even be fatal if the drug is not discontinued correctly. Okay, a few more side effects to keep in mind. Drug-induced lupus is associated with isoniazid use, so we have our recurring lupus wolf alongside our hero to fend off the attack. The lone wolf for the lone ranger. I like it. We also have a big pile of manure in the background, just in case you need to rack your brain and remember that isoniazid is one of those pesky mud piles agents that can cause anion gap metabolic acidosis. One more thing. Drug interactions result from the ability of INH to inhibit the cytochrome P450 enzyme system. Cytochrome P450 is always symbolized as a CYP450 license plate on a chrome bumper. Its inhibition, represented by this bumper attached to a carriage, broken down and inhibited, if you will. So remember that INH can increase concentrations of drugs such as antiepileptics and warfarin. On to our next cast member, rifampin, the rifle expert. Not only is this sharpshooter active against mycobacteria, he's also active against certain gram-negative bugs, which we'll cover. First of all, notice that we've added another carriage. This time, however, the carriage is fully operational and racing out of control. This is because rifampin is a potent inducer of the cytochrome P450 system, unlike isoniazid, which is an inhibitor. Let's sketch in our recurring sketchy symbol, the CYP450 license plate on a chrome bumper. Remember, when you hear the name rifampin, think revs up cytochrome P450. Rifampin works by binding to bacterial DNA-dependent RNA polymerases, thereby inhibiting RNA synthesis. We'll enact this mechanism of action here. This runaway carriage is racing alongside a train that some of the bandits have commandeered. Well, our sharpshooter has a plan. He's aiming his rifampin rifle at the track junction switch, inactivating it in order to derail the train. This junction from a double-stranded DNA-looking track to a single-stranded RNA-looking track will represent DNA-dependent RNA polymerase, bound and inactivated by rifampin. This is also the location where mycobacteria can develop a resistance to rifampin from mutations in their RNA polymerase, making rifampin unable to bind. In fact, resistance rapidly develops when rifampin is used as a single agent, so it's rarely used alone. However, there are a couple situations where rifampin can be used as a single agent. If you need prophylactic coverage for some meningitis-causing pathogens, he's your huckleberry. Rifampin is used as prophylactic monotherapy in those exposed to Haemophilus influenzae or Neisseria meningitidis. In other words, in close contacts, rifampin can be used to eliminate carriage of these bugs. To show this use as monotherapy in close contacts, we have the carriage driver next to our rifampin sharpshooter coming into close contact, clutching onto him for dear life as he lets go of the reins of the carriage. And above, on the side of the train, let's sketch in the destination New Mexico, with the N and M highlighted to represent Neisseria meningitidis. We've incorporated a design of two red circles and the head of a Native American with our recurring red meningitis mohawk to represent the gram-negative diplococcus shape of this meningitis-causing bug. And immediately above, we have our recurring symbol for Haemophilus influenzae, our H-flu biplane. Notice the H design in its wings. It's an early aircraft, signaling the end of the cowboy era, no doubt. Okay, a couple side effects of rifampin to mention. Hepatitis from rifampin is uncommon, but is more commonly observed in patients with predisposing factors, such as co-administration of other hepatotoxic agents. This includes other ripe therapy drugs. So remember that big liver spot on the cow in the center. Also, rifampin may produce an orange-red discoloration of body fluids, such as urine, tears, sputum, feces, and even spinal fluid. So inside our rifampin carriage, we have a fellow cowboy getting his orange beverage all over himself as the carriage speeds out of control. Patients can rest assured, however, that this is a non-hazardous side effect. Our next hero, ethambutol, or Ethel the cowgirl. Part-time horse wrangler, full-time gunfighter, we've drawn her here wrangling a horse at the town wall. This represents its mechanism of action at the mycobacterial cell wall. Ethambutol blocks the enzyme arabinosyl transferase, thereby inhibiting carbohydrate polymerization at the cell wall. Think ethambutol at the wall. And Ethel is wrangling an Arabian horse, representing the inhibited arabinosyl transferase. The Arabian horse is knocking over a part of the wall that is designed to look like a carbohydrate structure. Hence, its polymerization is inhibited at the cell wall. Ethel is holding her hand out, telling the horse to stop. This is to emphasize ethambutol's bacteriostatic mechanism of action, not bactericidal. The most common serious adverse event is optic neuritis, leading to loss of visual acuity and red-green color blindness. To symbolize this, let's sketch in some red and green blinders on this Arabian horse. Alright, let's meet our last ripe therapy agent, pyrazinamide, the pyrotechnics expert. This pyro is only used for treating tuberculosis. And here he is, waiting calmly for the mycobacterial bandits, ready to detonate some strategically placed explosives at any moment. Dying ain't much of a living, so against his otherwise volatile nature, he's a knitter, not a fighter. His yellow knitting needles symbolize the pesky needles of hyperuricemia caused by pyrazinamide. While not a reason to discontinue therapy, increased uric acid can precipitate gout attacks. symbolized by this yellow, gouty ball of uric acid yarn resting on his big toe. Pyrazinamide can also be hepatotoxic, even leading to liver necrosis. So remember that cow liver spot. All right, we're burning daylight, so let's sum up this sketch. Ripe therapy, 4 for 2, then 2 for 4. Our first hero, isoniazid, the isolated ranger. It can be used as isolated therapy to prevent reactivation of latent tuberculosis. When you think of INH, think injury to neurons and hepatocytes. It's co-administered with the pyridoxine pair of dice to prevent neurotoxicity, but watch out for those slow acetylators who are at higher risk. The liver spot on the cow in the center represents hepatotoxicity associated with all ripe therapy agents. Remember, he's at the wall shooting down mycobacterial bandits because isoniazid works by decreasing mycolic acid synthesis at the mycobacterial cell wall. And remember, it's an inhibitor of the cytochrome P450 system, while rifampin on the left is a potent activator. Resistance is rapidly developed to rifampin when it's used alone. However, it can be used as solo prophylaxis in close contacts exposed to Neisseria meningitidis and Haemophilus influenzae. It works by shooting that RNA polymerase track switch. And remember those common but harmless orange secretions. Ethambutol, also at the cell wall, it blocks carbohydrate synthesis. The classic side effect, red-green color blindness. And our last hero, pyrazinamide, likes to knit, precipitate gout attacks, and cause hepatic necrosis. But remember, that big liver spot in the center, it pertains to all of them. Well, that's the end of our story. The bandits defeated. Well, I guess they had it coming. We all got it coming, kid.